everybody, this is Neha here, and today at Lilavati Hospital we have a very special person, Mr. Dhiraj Gupta. He would be a better person to introduce himself. So, sir, could you please briefly introduce yourself and your area of expertise?
Sure, Neha. My name is Professor Dr. Dhiraj Gupta. I'm a cardiologist, but within cardiology, I am a specialist in a field of cardiology called electrophysiology. So I'm an electrophysiologist. I specialize in heart rhythm disturbances. I've been based in the United Kingdom for the last 25 years. Originally, I'm from India, but for the last 25 years, I've been practicing electrophysiology in the UK.
Okay, so as sir mentioned, he's been practicing in electrocardiology since 25 years. So many of us would be aware of it, but for those who are not aware of it, what are the common heart rhythm disorders?
So heart rhythm disorders are extremely common. They affect millions and millions of people worldwide. As the population is getting older, the prevalence of atrial fibrillation and these heart rhythm disturbances is increasing. And so we electrophysiologists are becoming increasingly busy as more and more patients develop these disorders.
So you are specialized in atrial fibrillations, particularly as you mentioned. So how serious these conditions could be if left untreated?
Sure. Well, atrial fibrillation can increase the risk of stroke 5-fold and the risk of heart failure 2 to 3-fold.
Yeah.
It is a silent and slow killer. Unlike a heart attack, which can kill instantly or within minutes or hours, atrial fibrillation doesn't do that. It has sometimes been likened to a slow poison. If untreated, it can increase the risk of death through stroke or heart failure. And many population studies have shown that if untreated, atrial fibrillation can decrease your lifespan by between 5 to 8 years.
So what are the latest treatment technologies to treat these arrhythmia disorders?
So for many years, the only treatments available for atrial fibrillation were medication. So you would take blood thinning tablets to lower your risk of stroke, and you will take rate control medications to improve your symptoms. But for the last 10 to 15 years, a treatment called catheter ablation has really evolved, in which we can actually cure atrial fibrillation by putting catheters inside the heart through just small keyholes in the neck. We can treat those areas of the heart where atrial fibrillation is coming from. And once we do that, we can cure atrial fibrillation. And this has really revolutionized the treatment of atrial fibrillation worldwide, especially the West, in the US, Europe, the United Kingdom. This is now the first-line treatment for many patients with atrial fibrillation.
Okay, so as you said, atrial fibrillation is curable and we have multiple options to treat atrial fibrillation. So, sir, as you mentioned in the beginning that you have been working globally. So we would like to know what made you choose Lilavati Hospital to practice cardiology in India.
Sure. Well, I grew up in India. I did my training in North India. I did my MD medicine from PGI Chandigarh, DM cardiologist from All India Institute in Delhi. And all along, Lilavati Hospital had a huge reputation nationally. Even though I never practiced in Mumbai, we were all aware of Lilavati Hospital, its reputation for ethical, good quality work. And when I started visiting India over the last 10 years, training cardiologists in AF ablation, I realized that there was a vacuum in Mumbai. There were lots of people with atrial fibrillation who were not being able to access catheter ablation. In fact, I had patients coming to me from Mumbai to the UK to have this treatment. So I then met cardiologists here in Lilavati, and I was totally convinced that they and I shared the same vision to provide a good quality service to the patients and make a real difference to the city.
So how patients in Lilavati hospitals could benefit from your global experience?
Well, I have dedicated the last 25 years of my life to treatment for this condition.
Yeah.
So as I said, I'm an electrophysiologist, but within electrophysiology, also you can do simple electrophysiology, or you can specialize in complex electrophysiology, including atrial fibrillation. And that's what I've been doing for the past 25 years. I've published over 250 scientific papers. I lecture all over the world. I train cardiologists in this ablation technique all over the world. So I'm hoping that patients in Mumbai and surrounding areas would be able to benefit from that expertise.
Yeah, sure, sir. We are going to truly be beneficial from you having here, and we are very glad that we have you here in Lilavati Hospital. So as sir said, he's a specialized person in atrial fibrillations, or atrial fibrillation is very common nowadays. So the treatment which you are providing, so it is for all types of atrial fibrillations, like all kinds of people coming here with atrial fibrillations, or there's some specific kind of people?
Sure. So the catheter ablation treatment works best in those patients with the relatively early stages of atrial fibrillation. So in those people in whom atrial fibrillation is intermittent rather than all the time, or whose atrial fibrillation has become persistent, which is the next stage, but it has not been there for years and years and years. So in those people, the outcomes of this procedure are excellent, over 90% chance of success. If somebody has been in atrial fibrillation for years and years, then this treatment is wrong.
Okay. So as we are very technologically advanced nowadays, so can smartwatches or any technology today can help us detect any symptoms of heart arrhythmia disorders or anything like that?
Sure, smartwatches have really revolutionized the way we manage patients with arrhythmias. So many patients have non-specific symptoms such as palpitations. Now, palpitations can be benign,
Yeah.
but sometimes those palpitations can be because of atrial fibrillation. Smartwatches are extremely sensitive in picking up atrial fibrillation. And in fact, many times I have people come to me in my clinic saying, "Doctor, my smartwatch has identified atrial fibrillation." And the smartwatches are so accurate that you can actually confirm the diagnosis before a simple ECG would have done. Not only that, we can use smartwatches to monitor treatment after ablation. So if the patient was having lots and lots of atrial fibrillation before, and you've done catheter ablation, the same person, same smartwatch will now show that the atrial fibrillation is no longer present. So I think our smartwatches and wearables in general are revolutionizing treatment for this condition.
As we are coming to the end of this session, we were very glad to have Dr. Dhiraj Gupta sir with us today here. So sir, what message would you like to share with the patients experiencing heart-related disorders?
Sure. Well, what I would like to say is heart rhythm disorders are now curable. I have a simple mantra. If you can cure, why endure? Atrial fibrillation is curable now. Please do not accept it as a lifelong condition. Seek out experts and expert opinion and try and get it fixed.
Thank you so much, sir. It was a very insightful session. Coming to an end of this session, we have Dr. Dhiraj Gupta here. It was lovely having you here with us, sir. Thank you so much, sir.
My pleasure, Nia. Thanks for having me.